Hi, I'm Dr. Young. I'm a facial plastic surgeon in the Seattle and Bellevue area, and I'm going to be talking about facelifting and facial rejuvenation. In particular, I'm going to talk about the actual facelift procedure. Now, you might be wondering whether if you're a candidate for facelifting, and one of the most common questions is, what is the age range that typically a facelift is useful for? Well, it really depends on your particular anatomy, your genes, and your life changes on whether you're ready for a facelift. I've done facelifts on essentially on someone who was 34 to someone who is 94. Now, those are pretty extremes, and usually when it gets to those extremes, I always have a conversation with them to assess whether they really need this procedure. A lot of times when I do that, they end up being more persistent on getting it done, and a lot of times when I think that a person is a little too young for the procedure, they end up looking fantastic from a facelift. So the age range doesn't really necessarily matter. It really matters on how the person got to where they were. Now, on the facelifts that I've done for people that were in the 90-year-old range, you often think that at that point you might be concerned of their health and other factors, but usually there's been papers that talked about different age ranges, and what they've shown is that if a person's healthy, that 90-year-old or that 80-year-old should tolerate the procedure just as well as a 30 and 40-year-old if they're healthy. And that's been the case for me. What I found, that as long as they're healthy, people that are in the 80s and 90-year-old range typically handle a facelift extremely well, and it's really depending on the person. And the facelifts that I've done in people that have been in the 90-year range, they've done extremely well. Now, you might be wondering, what does a facelift improve in the face? Essentially, I think it really depends on the person. Typically, a facelift benefits the person that has a lot of extra skin and a lot of sagging. It's that person who started out as a grape and gained weight and expanded that grape and then shrunk down to a raisin. I think that's the analogy that I usually like to use, but they've accumulated extra tissue that can be removed and lifted, and a lot of times those particular patients benefit from a facelift where they take away some of the skin and tissue. But if that person never really gained a whole lot of weight and essentially went from a grape to a raisin, I think that person would benefit more from volumizing, like with fillers and fat injections, or the YoungVitalizer. So when you come in, I typically tailor a particular approach to you depending on how you've changed through your life. So another question about facelifts that is really common is, how long does it last? Now, that's a really good question, because you want to know if you're going to spend all this money, if this is going to be a lasting procedure. Now, there's been a few studies out there that have tested this, and what many people have found, or these studies have found, is that people tend to want to get another facelift or some other things done at around the 8 to 10 year mark. Now, the question is, so based on that, you tend to think that the facelift lasts 8 to 10 years, but that's not always the case. When I see people back, or when I see people in my office and they've come and they've said, oh, I've had a facelift 8 to 10 years ago, at that point when I see them, I bet they could have had something done 5 years ago. So those studies don't always say everything about how long a facelift lasts. But in general, I think if it's well done, it should last somewhere in the range of 8 to 10 years. Now when you're always going to continually age. So when you look at the results and say, oh, it's going to last 8 to 10 years, it's not like you're going to have these results, you know, right after your facelift, and all of a sudden at the 8 to 10 year mark, it's going to go like this. It's more like a gradual process that you're going to get to that point. You're always going to keep aging, but the way I explain how you're going to benefit from a facelift is that if you had a twin and you had a facelift or something done, you'll always look better than that twin that did not get something done at every point in your aging process. Now, how much does a facelift cost? Essentially, it really depends on where you go and who the doctor is and that doctor's experience. A facelift can range, and depending on what is done, a facelift can range anywhere from $3,000 to $100,000. A lot of it depends on what's being done, like if you do a neck lift or you do a brow lift. But when you're talking just straight facelift, that might include just pulling, that include maybe working on the neck. That's something to ask your doctor, what does this actually do? In general, I think facelifts can range anywhere from $3,000 to $15,000 in that range. And the extremes are in that $100,000 and $3,000 range. And again, the average may be around $6,000 to $12,000. Now, in terms of costs and pricing, you definitely don't want to go to, in my opinion, the physician or the plastic surgeon that charges the lowest amount. But there's a lot of factors that I think are more important in terms of choosing a doctor, and that includes how he approaches doing a facelift, and looking at the before and afters, getting a feel of the philosophical approach of the doctor, whether he really cares about what he does is so important, and his training is really important, whether he's board certified. What are the things that set him apart from other doctors? Has he come up with a theory on facial beauty, or what are his thoughts on beauty? How did he score in his exams? These are all things that I think that are really important to ask the doctor. And it doesn't matter if the doctor has done thousands of facelifts. You want to make sure that he's always improving, always doing his best for every particular patient. I think a doctor is only good as his last facelift, and whether he's constantly improving his results.